Oppositional defiant disorder, presented by Tanya Miller for TED 494, 2018 summer session. Okay, this slide discusses what is oppositional defiant disorder. This is a controversial disorder by many. Some would argue that this diagnosis is just extreme tantrums and defiant behavior. But as I did the research, it is just much more than that. And there's a clinical diagnosis of this disorder that has to be persistent and extreme in order for this diagnosis to be given. However, oppositional defiant disorder is, like I said, just more than tantrums and defiant behavior. Oppositional defiant disorder, also known as ODD, is a childhood disorder that affects boys and girls, and they must have persistent patterns of anger or irritable mood, argumentative or defiant behavior, or vindictiveness. These behaviors are described in the Diagnostic and Statistical Manual of Mental Health Disorder, 5th edition. This is also known to clinicians as the DSM-5. Again, I just want to go over the fact that both boys and girls are diagnosed with this disorder, but it is typically found that more boys are diagnosed than girls. This slide discusses the clinical characteristics of oppositional defiant disorder, and this leads to a diagnosis. The diagnosis of oppositional defiant disorder is typically given by a psychologist after they do a number of tests and such. This slide discusses the 3 criteria and then the symptoms that follow in those criteria categories. And these symptoms, both behavioral and emotional, need to be persistent and last longer than 6 months. They also need to be displayed with someone other than the child's sibling. Okay. The category of anger and mood has the following symptoms. The child is often and easily loses their temper, is frequently touchy and easily annoyed by others, and is often angry and resentful. In the category of argumentative and defiant behavior, the symptoms include often argues with adults or people in authority, often actively defies or refuses to comply with adults' requests or rules, often deliberately annoys or upsets people, and often blames others for his or her mistakes or misbehavior. And finally, the last category is vindictiveness. And the symptoms under this area include a child who's often spiteful or vindictive, or a child that has shown spiteful or vindictive behavior in at least twice in the last 6 months. This can include stealing or lying and just really avoidant behavior. For some children, symptoms may be only seen at home, but over extended periods of time, they can be seen in other settings, such as the school and with friends, and that's often the case. So behaviors that the outside world may see in a child with oppositional defiant disorder are many. Those may include violent behaviors such as punching, kicking, or biting. Commonly, the child will have tantrums, but they will be extreme, and there will be no calming of these tantrums, and they will last longer than 30 minutes. again, that vindictive behavior is dishonesty, or like the mere enjoyment of doing things that upset others, lying when they know they've been caught, or just the feeling of watching another person or child become upset. Children will often ignore rules or the laws set in place for them. They will destroy things, whether that be their personal belongings or others. And they will also have threatening behavior. They'll threaten other students, adults, people around them, and they will typically pick arguments for no apparent reason. So there's also a clinical assessment that needs to be done in order for this diagnosis to happen. This is not an assessment that a school psychologist could do, like some can be determined within the school district. It is most common that a child will first see their primary care provider and then get a referral to a mental health provider, who will then perform an evaluation. The evaluation has several components, and these components are put together to see if the child meets the criteria for a diagnosis. The components are going to give a clear understanding of the characteristic traits of this disorder. And if a child does display frequent and persistent patterns, again, of the anger or irritable mood, argumentative or defiant behavior, or vindictiveness in at least the 4 symptom areas that last longer than 6 months, then a formal diagnosis of ODD will be given. However, if a child doesn't meet that criteria, there may be other differential diagnoses that provider may classify this child of having. The diagnoses that kind of fit this realm but may not quite match the criteria include conduct disorder, attention deficit hyperactivity disorder, or ADHD as it's commonly known, depressive and bipolar disorders, disruptive mood dysregulation disorder, intermittent explosive disorder, intellectual disability, or social anxiety disorder. These disorders are commonly kind of classified as a blanket of disorders that oppositional defiant disorder could easily match with. So this diagnosis is difficult to determine. However, they go back to the 4 symptoms areas that last longer than 6 months. That's how the formal diagnosis is really laid out for these children. Diagnoses will lead to treatment options and services and referrals that can be provided. So that is why if you are not given a formal diagnosis of ODD, it's common that these other diagnoses will be given. Let's take a look at causes and risk factors. It is important to note that there is no clear or direct cause of oppositional defiant disorder. However, there are some contributing causes in a combination of inherited or environmental factors that may pose a risk, I suppose, to a child and predetermine ODD. That would include genetics, a child's overall natural disposition or temperament, and then the child's environment. This can include problems with parenting, such as a lack of supervision, inconsistent or harsh discipline, or unfortunately abuse or neglect. Possible risk factors that can lead to oppositional defiance include temperament. A child that may have a difficulty regulating their emotions. They're happy, extremely happy, or they're extremely sad, they're extremely mad, one extreme to the other, not able to kind of regulate those emotions throughout the day. parenting issues, a child who experiences abuse or neglect again, that harsh or inconsistent discipline, or simply a lack of supervision, no set boundaries, guidelines of how a child is supposed to act in certain settings that they go in. Other family issues, if a child is in constant crisis or turmoil, chaos, those can all lead to, again, just that disruption of emotions, and that's where kind of that irregular emotion is found, and so that child is not able to regulate their environment, and so those emotions kind of get caught up in that as well. And then last, the environment of the child. Oppositional defiance can be strengthened and reinforced in the child's environment. For example, the child's peers may really egg on their behaviors. Inconsistencies with the child's discipline, boundaries, and rules provided in the home, they may be different than in the school district, and not having a firm set of expectations can add to further behaviors and risks. Prevention. It's safe to say that there is no guaranteed way to prevent oppositional defiant disorder. Positive parenting and early treatment can improve behaviors and prevent symptoms from becoming worse. Educational considerations. What is a teacher's role in this behavior modification? In doing the research for this, it was found that teachers in schools often feel like hopeless in helping a student with oppositional defiant disorder, because oftentimes treatment really, really focuses on the family and the family dynamics and parenting practices and techniques and how to improve those things in order to improve the child's overall behavior, environment, and so on. However, teachers can find that they have a specific role in conflict prevention and in classroom management when the child is in their care. Teachers can help a student by maintaining a positive classroom structure by using several of these key points that are found on this slide. Just to note these key points, a teacher needs to maintain a good tone of voice while teaching. When they're teaching a lesson, they need to be happy and upbeat. If they're providing a consequence, then that needs to be firm and not willy-nilly, so to speak. It needs to be direct for that child to recognize. A teacher can take proactive steps in disciplining a student and decide what consequences go with what behavior. If this is kind of set already before behaviors become a problem, then there's no going back and forth. This provides consistent behavior modification, and then that student will see success sooner, and the teacher will then be able to go on teaching as necessary. A teacher can offer peer or one-on-one group sessions to help develop social problem-solving skills. This can be done in groups with a social worker that works in the school. This can be done with a school guidance counselor. It's kind of whatever the school district has available for their students. Locally, we find that our smaller school districts have just school guidance counselors, which can pull these children aside and really help focus on their social skills and their problem-solving skills. Another way teachers and the school can help these children with this disorder is to plan ahead to avoid trigger situations in classroom and school property. That means knowing what students might be a trigger to the student or what might ag on this child's negative behaviors or reinforce those negative behaviors. This might mean helping the child problem solve before going into a certain class of concern. These are ways that teachers can gain control and really help these students become successful in their classrooms. Support services and resources. It is important to note again that treatment is often found in family-based interventions. And these interventions can last a long time, several months or longer. It is important for families and for families to recognize and for schools to help promote the treatment of any co-occurring or symptoms that are occurring at the same time as the symptoms with ODD, such as a learning disorder and other mental health problems, because if those are untreated, you will not scratch the surface of treating oppositional defiant disorder. We will find that treatment that involves the family-based interventions include parent training. This helps the parent develop the skills to be more consistent, more positive, and this creates a less frustrating environment for the child and the parent and the family. Other things include parent-child interaction therapy. This is therapy that involves a therapist who coaches the parents while they interact with the child. This may be just a way of getting the parent to understand positive language, positive disciplining approaches in the moment. Individual and child therapy is always good for rectifying this behavior. This can happen inpatient at an office, or at times I've seen and I've read during this research that in-home therapy is also a positive a solution to these problems. And problem-solving skills. Problem-solving skills can be taught in the school with the school's social workers, school guidance counselors, teachers, or in the home. And this is following just a professional's advice on how best this child will acknowledge and take in how to problem solve. Social skills training is also something that's important for these children. This can also happen in school or in outpatient sites. I want to note that consistent use of these positive known strategies will help provide structured environments in both the child's home and in the school settings. This is really important to understand, because this means that the student's family and the school really need to work together to maintain this positive momentum to ensure change in the right direction. The following pages are my reference pages. I pulled my information from that American Psychiatric Association Diagnostic Manual for Mental Health Disorders, that DSM-5. I pulled from the internet manuals of oppositional defiant disorder, disruptive and inappropriate behavior when it becomes a problem or a disorder. So there we have it. Thank you for listening, and I hope that you were provided with some information and resources and referrals that can help in your future classroom and in helping children that are diagnosed with this disorder.